I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai, taking care of this aspect of awareness today, which is called as prostate health. Prostate health for all men is an important aspect. And let's take this forward in a short understanding of awareness where we're not much aware of what is happening. Believe me, individuals from late 40s, 50s to 80s come to us as urologists across the country with their own aspects of concern, with their own aspects of discomfort, and we need to take this subject head on for everybody. So for all of you who are ambassadors of prostate health today, which is an important health for all men as they gracefully age, it is important for us to identify that is the prostate. So urinary bladder is something which is in the lower part of the abdomen, where when the bladder fills up, you get a sensation to pass urine. So urinary bladder fills up, and then you go to the washroom, you open the zip, the bladder contracts and pushes urine out, the passage opens up and urine comes out. It's as much as I walk, the door opens and I reach outside. So when I feel like walking out, I get up, door opens and I reach outside. Similarly, when the bladder is full and we go to pass urine, the bladder contracts, the passage opens and urine comes out. Have a look at this phenomena of understanding since our birth till 40s, 50s and 60s. As progression of change happens, there's a disease which comes as benign prostatic hyperplasia or BPH, very common phenomena that men go through at various categories and stages around. When we look at the prostate governs the urinary health by the urinary passage or urethra going through the prostate. So urethra goes through the prostate. Remember when we were younger in our 10s, 20s, 30s, 40s, the urinary passage was wide open. So the urethra was wide open at that point in time, and the prostate was in the periphery, and the urine would come out very freely. Like the door was wide open, we could easily walk out, and you would pass urine onto the wall with a strong flow. The flow was very good, we could paint on the wall. This urinary passage is governed by the prostate, and prostate is a male gland governed by the hormones. Hormones change in men from the 40s onwards, as a result of which the prostate can enlarge. So prostate can enlarge and can get bigger. But what is our request? Our request is, if you have a urinary complaint where the urine is not flowing well, where the urinary flow is of a narrow stream, taking time to pass, does not empty completely, you have to strain to pass urine, etc., etc., the urinary passage is getting blocked. So this open urinary passage is getting blocked is visible to us. Now, the measurement that happens commonly in health checkup or in the society by any and everybody, including our general practitioner colleagues, is about the prostate size. The normal prostate is 10, 15, 20 grams. It can increase in size to 25 to 30, 35 to 50, and beyond to 75, 100, 150, 200 grams. Prostate can increase in life to some size, which can be very big. Our intention today is to identify if the large prostate is a concern or the prostatic obstruction or blockage is a concern. So have a look at the urinary passage. That's a urinary passage which is gradually getting blocked. A passage which was wide open in younger age group, it's gradually getting blocked to a point in time where the whole passage can get choked. As a result of which, urine may not come out freely. So what do men complain? Men complain that it takes time to start urine because there is too much of resistance out here and the bladder has to push more. Sometimes they push from our tummy to start urine out. And then the urine is a very poor flow or dribble, takes time to start, and then it ends very late. And when it ends, the bladder is not empty completely. So hesitancy, obstruction to the flow of urine, straining, passing in drops, dribbling, incomplete emptying are phenomena which happen in 50s, 60s, 70s and 80s. Men complain of this. As a result of which, the entire aspect of flow is gradually progressive. This is a progressive phenomenon. What is in 50s will be worse in 70s and then in 80s and 90s. So for us, all men in the society today, if you are late 40s, 50s, 60s to 80s, and you have got a urinary complaint, your urinary flow is not as good as it was that passing to the wall, it is important for us to wake up to a phenomenon that we are probably suffering from BPH or a prostate change which occludes the urinary passage internally. Our flow may not be so great and we need to improve our flow. Our flow should be such that our speed of urine was what it was. It will never happen because age changes and gracefully the prostate is undergoing a health change. Now prostate can grow and block the urinary passage. It can also grow into the bladder and cause a median lobe anomaly. And this cannot be shrunken by medicines. So your urologist, after he tests his PSA, he tests his uroflowmetry, does a detailed rectal examination, evaluates the whole phenomena and studies at what level are you in, what stage are you in. Are you a man who can be treated medically? Are you a man who's all completely obstructed? Is important for us. So when we look at this aspect, we make everybody aware. 40s, 50s, 60s, 70s. Nobody is escaping it. Everybody is getting it slowly, progressively, and we got to pick it up in time. Therefore, one needs to understand what kind of therapy do we do. One therapy, a common therapy, is a combination of alpha blockers, which improves the flow by relaxation of the prostatic urethra, and in due course of time, addition of 5-ARI, which is finasteride and dutasteride, attempts to shrink the gland gradually, slowly over time. So that's a medical management to the whole thing. But this is not a medical disease. It's not fever where you need paracetamol. It's a disease of progression, a disease which will happen slowly and progress to a point in time where we'll wake up to various phenomena. As this happens, the bladder suffers. So bladder is contracting erratically and tend to force, push, and the passage is gradually getting blocked. Not in days, weeks, months. It's over years and decades that this progression happens in 40s to 80s. This blockage of urine can be such that the flow may be very poor, and one fine day, who knows, may get blocked. So why not be aware of this phenomenon? Why not to wake up to a phenomena when we as men would be undergoing treatment medically? So there are many patients who come to Coquelin Hospital where they are taking medicines. Medicines of the names available in terms of two different actions: improving the flow, shrinking the gland. And if the flow is not very good, why are we taking the medicines? If the flow is such that we stop medicine for a day or 3 and the urine gets blocked, why are we taking the medicines? That means we haven't achieved a situation where we are getting towards a cure. The intention of these medicines was to reverse you, to get you better. But if with age-related changes the reversals are not happening, time to wake up to a phenomena where a urologist would enucleate or remove the gland internally. The standard of care in that era was TURP, then became the holmium laser therapy and many more therapies. If the gland is very big, we remove it robotically through the bladder, and therefore we don't touch the urethra, narrow and a sensitive organ. So it depends again on what choice an individual has to be given by a respected urologist in the country. And therefore, we are armed to the teeth with various armamentariums which is required to treat an individual. The medical treatment, avoiding constipation, not drinking too much of water at night, attempting to empty our bladder with the best of therapy, and identifying later on who is the culprit. Is bladder the culprit not pushing urine out, or is passage getting choked and blocked as looked at by the uroflowmetry and by the urodynamics, which defines and evaluates the internal passage very well. So friends, treatment is around the corner for all individuals who have got urinary complaints. Sadly, what we do is we start doing ultrasound year by year, looking at what does it mean, and the prostate is increasing in size and gradually getting bigger and troubling us. So our issue here is to wake up to a phenomena that it's not the prostate size alone we are bothered about. We are looking at the prostatic urethra which is getting blocked, and that urethra is a trouble. It can actually choke, block completely and can trouble us. So our phenomena today is to wake up. Wake up phenomena for all men on this awareness drive where prostate changes are ubiquitous and not uncommon. You would wake up to a phenomena in emergency late when the urine gets completely blocked, or you get a urinary tract infection, or you're taking medicines and you're not so happy. Your flow is not as great as I promised to you on the medications around. Therefore, we need to study, we need to evaluate, do a uroflowmetry, do a urodynamics as required, do a digital rectal examination, study and assess you and follow you up. Follow you up on a medical management, attempt to shrink the gland, attempting to improve the flow, attempt that the bladder does not suffer because we need to save the bladder. So all the therapies which actually improve the prostate health are trying to open. And today's minimally invasive treatment of the kind which is available as UroLift opens the prostate internally. So on one, we would go and resect the prostate. One, we would enucleate the prostate. In one, we would open the prostate. Again, it depends on who deserves what. Smaller glands, 30 to 80 grams, younger men, worried about ejaculation, erectile dysfunction, etc. Or on men who have got very poor reserves on the heart and can't take anesthesia. UroLift has stood test of time. It just opens the prostate completely. And your job is done. You pass urine well. So it's again a urologist to be deciding the way to take it forward for your health, which is a progressive change and deterioration in the prostate health. So it's important for us to wake up that the prostate size is not so important. The occlusion of the urinary passage through the prostate is important, for which we are not much aware. It's a progressive, slow phenomena which happens over decades. One find it till it becomes bothersome. And too bothersome is too difficult because sometimes it can be blocking, causing UTIs, bleeding, straining, and just can't empty urine anymore. Silently, it can actually cause a blockage here, and the entire kidneys can be swollen because of the complete blockage. So it's time to wake up, friends, from 40s to 80s, that if you have got prostate issues, if you have got urinary issues where the urinary flow is not good, it takes time to pass urine, does not empty urine. At the end of the urination, still lot is left over. I go to pass urine again and again. And this is happening for a long time. And now we have got an urgency, frequency and urge incontinence because the bladder is now getting overactive as a result of the blockage. It's all phenomena which is getting vicious. It's time for us to wake up to the phenomena to treat it. Prostate health is important. A small subset of individuals from this prostate changes could even land up in cancer prostate. Again, a urologist is qualified to examine you digitally, to assess your prostate PSA levels, to assess MRI and take it forward in those individuals who there is a suspicion and take it forward. So why sit on it? Why not evaluate this important aspect? Avail the choice of seeing a urologist in your cities and towns and look at picking up this in time. Prostate health for men will undergo a change. Either it could be an obstruction, occlusion by DPH, or it could be a change where there could be a cancer prostate which has to be picked up in time, evaluated, removed so that there's no more cancer left over. Friends, it's important for us to not to neglect health, not to neglect prostate health. It's time to bring prostate health to the front row seat for all men who are not responding to medicines, whose progression is happening, who are in trouble, who have got a catheter, who got a UTI, who bleeding in urine, and changes which have to be completely taken care of. So it's important for us to take it to the next level. Thank you so much.